We will now do the design for the short opponent's orthosis. The first portion of it is you want to place a point at a little bit below that MP joint of the 5th digit, so approximately right there. You want to slide over to that 2nd digit and go a couple inches below that MP joint as well. So feel for it and then go right there. The other 2 points go on either side of that IP joint of their 1st digit, approximately right there. We then slide down that CMC joint and place a point right there, and on the opposite side of that, right there. Then ask them to lift their hand and draw the lines connecting these points. Right there, and right there. We then draw some loops around so we get the proper fitting of the orthosis. A little bit hard on the paper towel. And when you cut out the design from that, you will get this. Hello, McKinley. Thanks for stopping by today. I know the reason you're seeing me is you have CMC osteoarthritis in that right CMC joint. Is that correct?
Yeah.
And you have pain in that joint. Is that correct as well? Okay. So we do have the short opponent's orthosis made for you recently. I know you stopped by for that. So the purpose that we made this device for you is to maintain stability on that CMC joint, but still allowing you to grasp and pinch things, okay? So the wearing schedule for this is we want to keep this on you for 4 weeks, mainly during activities that you use that right thumb joint, okay?
Okay.
So go ahead and stick with that. Cleaning instructions, what I want you to do is take an alcohol wipe or baby wipes, kind of rub around this orthotic all around, particularly after activity, but if you can't do it then, just anytime during that week, okay? Can you do that for me? Some safety and precautions we kind of want to look forward to is if you have any redness or swelling or maybe skin kind of breakdown along this joint area, you want to let us know because that shouldn't be happening with this joint. We can always refit it or maintain it as it occurs, okay?
Okay.
So I do want to show you how to place it on and off.
Okay.
So first thing you want to do is unhook this strap and slide your hand in. Once your hand is inside, place the strap onto the opposite side and make sure it's a secure fit. Can you do that for me? Okay. Go ahead and slide your hand in. Perfect. And place that strap. Does that feel tight enough? Okay. And go ahead and try to take it off for me. Just want to make sure you understood. And slide that hand out. Perfect. Okay, that's all I have for you today. Are there any questions regarding that?
No.
No? Okay, thank you. So some critiques I have for my orthosis design include rough edges along the bottom portion and some of the top portion. There are thumbprints, as you can see, on the thumb portion of the orthosis. Wrist flexion is limited, does not allow full range of motion during flexion. There are some gaps underneath and on the ulnar side of the orthosis, and some of the corners can be a little sharp. On the back side, we can see this portion of the orthosis is not flush and does not connect, and then rounding these corners on the tape portion would help decrease irritation.